Is asbestos exposure a lung cancer risk? Asbestos exposure is indeed a well-established risk factor for lung cancer. When asbestos fibers are inhaled, they can cause significant damage to lung tissue over time. This risk is particularly high for individuals who have had occupational or heavy exposure, such as construction workers. However, even environmental exposure near asbestos sources can increase lung cancer risk. Asbestos is a group of naturally occurring fibrous minerals. When these materials are disturbed, they release tiny fibers into the air. Once inhaled, these fibers can become lodged in the lungs, leading to inflammation and scarring. Over many years, this persistent damage can result in cellular changes that may develop into cancer. Major health authorities classify asbestos as a known human carcinogen. This classification comes from organizations like the International Agency for Research on Cancer, the United States National Toxicology Program, and the Environmental Protection Agency. These agencies recognize asbestos as a cause of not only lung cancer but also mesothelioma and other types of cancer. Research shows that workers with heavy asbestos exposure have a significantly increased risk of lung cancer. The relative risk for these individuals is about 1.7 times higher than for those who have not been exposed. This elevated risk does decrease over time after exposure ends, becoming similar to that of low-exposure individuals after approximately 20 years. Environmental exposure, such as living near asbestos sources, also raises lung cancer risk, though to a lesser degree. Another important aspect is the synergistic effect of asbestos exposure combined with tobacco smoking. This combination greatly amplifies lung cancer risk, more than the sum of each risk alone. For individuals exposed to asbestos, quitting smoking is especially important to help reduce their lung cancer risk. Lung cancer related to asbestos exposure often develops decades after the initial exposure, making early detection quite challenging. Symptoms to watch for include a persistent cough, shortness of breath, chest pain, or coughing up blood. If you have been exposed to asbestos, these symptoms should prompt a medical evaluation. In addition to lung cancer, asbestos exposure can lead to other serious conditions. These include mesothelioma, which is a rare cancer affecting the lining of the lungs, asbestosis, which is lung scarring, and various pleural diseases that can impact lung health. In summary, asbestos exposure is a significant risk factor for lung cancer, especially with heavy or prolonged exposure. This risk is further compounded by smoking. Preventing exposure, using protective measures in workplaces, and quitting smoking are critical steps for lung cancer prevention in those at risk. If you know or suspect you have been exposed to asbestos, it is essential to inform your healthcare provider and consider appropriate monitoring for early signs of lung disease.